So thanks everyone for joining us today. I'm Jeff Stinson. I'm the director of HealthTech Arkansas. This interview is one of a series that we're doing with healthcare innovators around the state of Arkansas. Today we are really fortunate to have Dr. Mark McManis with us from Arkansas Children's. Welcome, Mark.
Thank you.
We are really glad you're here. The HealthTech Arkansas team has been working with Arkansas Children's for about 1.5 years now. And in that period of time, you and your wife and Dr. Fred Perkins have seen more of the HealthTech Arkansas team than you probably wanted to in the past 1.5 years. But we've become very familiar with each other, and we have certainly enjoyed that work together. So we really appreciate the opportunity to chat with you about some of the things that you're doing. So I guess I'd sort of like to kick things off by, talking about the fact that professionally you wear a lot of hats. You're a clinician, you're a researcher, you're a faculty member, and now you're an innovator, and probably have been an innovator for quite a while. So give us a sense of what your day job looks like. What's a day look like in the life of Dr. Mark McManis?
Well, excuse me. I would like to say that I don't see all of those as separate jobs. They are all related to one another. Mm-hmm. My clinical work involves doing brain mapping as part of preparing for surgery for the patients. So I am looking to maximize the positive outcomes and also minimize the negative outcomes of the brain surgery. So we're looking at where is the diseased tissue, where is the functional tissue in the brain. So to get better at that, mm-hmm. I have been moving more and more into innovative types of research, using, for example, artificial intelligence to identify lesions mm-hmm. in the MRIs that we see. Also, I've been looking at ways to use virtual reality to map out the brain and the functional and dysfunctional areas of the brain so that the entire team, so it's a surgical team, can discuss the best way to approach the surgery.
Mm-hmm. Yeah, that's fantastic. And, don't you think that many innovations, especially in healthcare, come about because clinicians do think in the course of their day-to-day jobs, there's got to be a better way to do this. And they start coming up with ideas for better ways. Absolutely.
Yeah. All of the clinicians that I have ever worked with are looking to improve what they do. Right. They do what they do because they believe it's the right thing to do.
Right.
But they are all looking to do it better. Can they do it faster? Can they be more accurate?
Right.
Can they be faster and more accurate?
Right.
So there is a lot of interest in innovating just standard everyday medical practice.
Right. And the work that you're doing in neurology innovation is obviously very important. I think you were doing some of that work at UT Austin before you came here. So what brought you to Arkansas? How did we get so fortunate to have you here?
Well, it's a little bit of a long story. The department here is run by a colleague of mine that I have known since we were completing our training many years ago.
Dr. Fred Perkins.
Dr. Fred Perkins.
Mm-hmm.
And we were in Houston, completed our training together, got to know each other there.
Right.
And both shared an interest in improving surgical outcomes for epilepsy patients, is where we started.
Yeah.
And over the years, we have worked together in different hospitals off and on. And when he became the chair of pediatric neurology at Arkansas Children's, he invited me up for an opportunity to look at the program. And when I got here, what I found was a tremendous amount of interest and support for the kinds of innovative work that Fred and I wanted to do. I spoke with administration in the hospital, and they were very supportive.
Right.
I spoke to administrators at the ACRI, the Research Institute,
Mm-hmm.
and they were very supportive.
Mm-hmm.
And they also introduced me to other people in the larger community who, again, shared an interest in technology development in the medical space.
Right.
So it kind of became a no-brainer with so much energy and so much interest in innovation that this was the best place for me to come in order to try to develop a better way to do this type of brain mapping.
Right, right. And that's fantastic. And out of that move, one of the really good developments is that you and Dr. Perkins and your wife have started a company now called Neuromed Pro that is all focused on this brain mapping imaging software that can help you and other clinicians better detect brain lesions. So tell us, give us your one-sentence summary of Neuromed Pro. What's the elevator pitch for your company?
So we at Neuromed Pro are developing AI-driven software to improve neurodiagnostics and neurosurgical outcomes for our patients.
Right. So, so all three of you are impressive individuals, with many professional accomplishments. Why did you want to start this company? What is it about entrepreneurship necessarily that interests you?
So I'm totally throwing my wife under the bus here. This is all her fault. Again, Fred and I have worked together clinically for several years. And during our work in the clinic, we realized that we had a lot of patients who were getting surgery for their epileptic seizures. And then after the fact, we were discovering that they had brain lesions, specifically focal cortical dysplasia.
Right.
And we started looking into, well, why are we discovering this after surgery and not before surgery? And how can we change that? How can we improve our diagnostics for these lesions?
Right.
And that led us to doing some AI research. It led us developing a model of lesion detection that we are now trying to commercialize, because what we discovered was a lot of these lesions never get discovered.
That's right.
And it prevents these people from moving on to surgical procedures that can truly cure them, of their seizures.
Right.
So we started thinking that we should spread the good news about what we're doing.
Right.
And discovered that we really didn't know how.
Right.
We didn't know what we were doing. And that's where my wife comes in. She had been working on technology development for years in her job with a educational technology company and with a healthcare and telemedicine company.
Right.
And she said, oh, we can totally do this as a business.
Right.
And she formed us into an LLC.
Right.
And we have since worked very hard to build this as a business.
Right, right. Yeah, that's fantastic. You know, you talked about sharing the good news, and you know, as we all know, one of the very best ways for any new healthcare innovation to impact patient lives is when, in fact, something is successfully commercialized. When you can get a new innovation all the way to the marketplace, that's how you touch the most number of people. And, you know, that's why, you know, we at HealthTech Arkansas, while we're so passionate about the work that we do, because getting these things to the marketplace is incredibly important. And we're just so fortunate to have folks like you all who are doing that good work and want to drive your innovations to the marketplace.
Well, one of our, excuse me, one of our goals when we started this was to push the expertise that we have here in Little Rock at UAMS and at Arkansas Children's
Right.
out to more rural areas
Right.
where they have fewer resources, fewer physicians,
Less access
less
to care.
access to
Yeah.
everything that
Right.
they need, less access to the technology. So the goal ultimately is to have expert levels of neurological diagnostics in every hospital in
Even
the
small
state.
community hospitals.
Even a small community hospital
Yeah.
can use computers
Right.
and artificial intelligence to improve their diagnostics.
That's fantastic. That's such a great goal. It really is. So as you know, we at HealthTech Arkansas, we joined together about a year and a half ago with the University of Arkansas, with the Conductor in Conway, and Startup Junkie in Fayetteville to launch this comprehensive innovation program for Arkansas Children's. I'd love to hear, what are your experiences inside that program so far? What do you think about our innovation program?
It has been fantastic. I just can't say enough positive things about it. We didn't talk about this earlier, but I've only been here for about a year, just a little over a year now.
Yeah.
And in that time, I have participated in the Arkansas Children's Commercialization Scholars Program.
Right.
And
That Sarah Goforth
yes.
administered.
And I have attended the NSF I-Corps program run through the University of Arkansas.
Right.
In addition, I have been mentored and gotten significant guidance on an STTR grant application
Right.
that we submitted.
Mm-hmm.
And I continue to get guidance and mentorship, particularly in the commercialization area and in business development from HealthTech Arkansas and from my mentors at the University of Arkansas.
Right.
It has been amazing.
That's great.
This is the kind of support that really makes a difference in getting these projects off the ground.
Right, right. That is perfect. I am so glad you feel that way. So talk about the next milestone for your business, for NeuroMed Pro, because I know we've actually got an application to the Technology Development Program coming up through AEDC, and we're trying to put some funding sources together to help you move your innovations forward. But talk about, what do you consider some of your next milestones, and how do you think we at HealthTech Arkansas can help you get there?
So where we are right now is we are trying to raise money to continue developing the AI model.
Right.
And we are trying to use as much non-dilutive funding as possible at this very early stage
Perfect.
of our company. And HealthTech Arkansas has helped us to identify multiple programs to apply to through the state of Arkansas that will support our technology development, and not only have we gotten help in identifying these programs, but we're getting help in the application process.
Right.
So it's not just here, go do this yourself. It's let me show you what needs to be done, and it's support all the way through the process.
Right.
And again, that makes a huge difference in what we're trying to do, because we don't really know
Right.
about any of these things.
Right.
None of us are really business people. I mean, my wife has worked in the private sector for a long time now, but
Right.
you know, I am a clinician and researcher, as
And
is Dr.
scientist,
Perkins.
yeah, yeah.
So we just don't understand what needs to be done. And I'll be honest, I have looked at these applications in the past and said, what are they asking for? What am I supposed to say?
Right.
How am I supposed to answer this question?
Right. Right.
And I find that now, with people that I can get advice from and guidance from, that I understand the applications better.
Right. Right. That's
So-
great. That's good. Obviously, we're glad to be helpful. So Arkansas Children's, I think, has really demonstrated some leadership in the innovation arena. When they launched this innovation program, which is branded the Arkansas Children's Innovation Center, about a year and a half ago, they made a big commitment to do that. They wrote not only a big check, but they committed a lot of their internal resources behind this to make this innovation program work. What do you think, for any health system who's thinking about this and thinking about developing or conducting more innovation work, what do you think the benefits it can have to that health system, including maybe the potential to recruit and retain other physicians? Because we know historically there's a certain percentage of clinicians who really enjoy this thing and they want to work at a place that supports their innovation work.
Absolutely. And again, most of the clinicians I've worked with over the years all want to improve what they do and how they do it. And they all have great ideas about what can be done. Most of them just don't know where to start.
Right.
I didn't know where to start
Right.
when I started. And what I was able to do when I got here, with all of the support from HealthTech Arkansas, from the ACRI, from ACH, is I was able to sit down and come up with a plan. And I was walked through what are the steps that you need to do. I learned about customer discovery. I had never heard of customer discovery prior to getting here. And what I have learned so far has been enormously valuable in all of the progress that I have made. And what I see available to the community of not just clinicians, but anyone in the hospital. If there are people who are in IT and they see an opportunity in the medical space, or if there is someone in medical billing who, again, sees an opportunity, a way to make this more efficient or better in some way,
Right.
these resources are available to them.
Right.
And all they have to do is reach out to access all of that.
Yeah.
And I think that makes a huge difference in the environment.
Mm-hmm.
The workers have an opportunity to develop a passion for improving healthcare, and that becomes part of the culture of the institution.
Right. That's great. All right, so my last question for you, Mark, is, you as a clinician, scientist, faculty member, researcher, have decided to take that first step out on the innovation path, and you've tried to figure out how can I commercialize this, some of my ideas, and get these things to market. We know that a number of your colleagues, both at ACH and UAMS and elsewhere, have their own ideas for innovations. What advice would you give to those clinicians who are walking down the hallways of a health system right now and they have an idea for a way to do something better? What advice would you give for them to, how do you get started?
I would tell them that absolutely what they need to do is reach out to someone, anyone, at any of these organizations.
Mm-hmm.
The administration at Arkansas Children's will help point them in the right direction.
Right.
The administration at ACRI will help point them in the right direction.
Sure. Yeah.
And there are a number of opportunities. There are a number of places where if they just reach out and ask for direction,
right,
those resources are available and they are out there.
right,
And it would make a huge difference. It doesn't guarantee success,
right.
but it puts you on the right path to success.
It gives you a
And
chance
I
for
would
success. Yeah.
absolutely, and I would absolutely encourage anyone currently at ACH or UAMS, if they have an idea that they think will make a difference in their workspace, that they should absolutely reach out and start a discussion about how they can improve their job performance.
Yeah, that's great. And some who see this may use you as their point of contact, and they may reach out to you and say, Dr. McManis, how do I get started?
Absolutely.
And you'll introduce them, and
yes,
you'll get them
I
going.
will.
So.
I will happily introduce them around to the people that
Right.
can help them get where they want to be.
Great. That is fantastic. Well, thank you for your time today. This has been great. All I will say is just keep up the great work. I mean, what you're doing is so important. When people, smart people like you who know and have the ability to impact clinical outcomes and to help people, and then have the desire to do something about that, that's the way innovation happens. So thank you for all of your work.
Thank you for all of your help, and I am happy to do this.
Great.